Welcome. I'm Julie Liu. I'm a public health advisor with SAMHSA's Emergency Mental Health Traumatic Stress Services branch. I will be today's moderator for this webinar. I'm going to allow our expert panel to introduce themselves.
Hello, my name is Megan Griffin. I am also a public health advisor with SAMHSA's Emergency Mental Health and Traumatic Stress Services branch.
I'm Captain Wanda Finch. I'm with the Center for Mental Health Services, Office of Consumer Affairs.
I'm Dennis Romero, Regional Administrator for SAMHSA in Region 2, covering the states of New York, New Jersey, Puerto Rico, and the U.S. Virgin Islands.
I'm Commander Carlos Castillo. I'm the Community Management Officer for SAMHSA.
Back in September of 2017, there were hurricanes that devastated U.S. Virgin Islands and Puerto Rico. The islands took a severe hit, which compounded the behavioral health impact of the residents, families, and the larger community. Several months after the storms, many hurricane survivors are still struggling with their new quote-unquote normal. To meet their longer-term behavioral health needs and in preparation for the approaching hurricane season, this webinar will shine a light on the preparedness for critical populations such as seniors. The purpose for our webinar is to first, increase knowledge and awareness, second, provide information resources and contact information to specific groups to improve response, and of course, third, protect the safety and well-being of the focused population, their family members, and caregivers. Now let's have our participants share with us their specific roles in this response. Dennis, why don't we start with you?
Sure. Thank you, Julie. I think my first concern creating the response for this disaster was ensuring that we had three things happening very quickly. The first was communication, ensuring that people had accurate information. Secondly, data, ensuring that people had the accurate data to help inform decisions. And then thirdly, develop a mechanism by which we could disseminate the accurate information that we were gathering.
So your role was really to disseminate information and provide accurate information to whether it be first responders or just survivors themselves.
Yeah, along the lines of coordinating this across various agencies and various sectors within the disaster response.
Wonderful, thank you. Wanda, what about you? What was your role?
I served as a team lead for St. John's Island, a subcomponent of a group of 23 officers that we were divided to actually work on the U.S. Virgin Islands. And I was also the behavioral health liaison to the Federal Emergency Management Agency, point of contact for St. John's as well.
Wonderful. And Carlos, your role was involved in this response?
My role was twofold. On the first deployment was September. That was when Hurricane Irma had hit the U.S. Virgin Islands. So I was sent to Puerto Rico in a team as part of the services access team to coordinate what they call definitive care for those evacuees and refugees from the Virgin Islands. So Puerto Rico was being used as a hub to service these folks. A little after, about 2 weeks after we were on site, Maria came to Puerto Rico. Then we became a disaster zone ourselves. On my second deployment, I became the liaison officer between FEMA and the Department of Health and Human Services for what we call the immediate disaster case management on the island.
Great. And then Megan, your role in this response?
So I serve as a project officer for the Crisis Counseling Training and Assistance Program for Puerto Rico, and I work directly with Puerto Rico's Mental Health and Anti-Addiction Services Administration to support them with their crisis counseling program, known locally as Proyecto Animate, where we support over 300 crisis counselors in all 78 municipalities across Puerto Rico.
Wow, so we have a really wide range of experiences and roles that everyone has played in the response of this disaster. Let's go ahead and discuss specifically the older population, the older adult population. Dennis, maybe you can start us out. What was your experience working with the older adult population?
So soon after the disaster, the hurricanes came through, we initiated the collaboration of the various agencies engaging in disaster response. Internal to SAMHSA, in collaboration with the behavioral health authorities of Puerto Rico and the Virgin Islands, I wanted to make sure that we had identified key vulnerable populations. And the two groups that we identified from the very beginning were children and youth and older adults.
Wonderful. And I know older adults are a very specific population, and there's a great need on the island. Wanda, what were your experiences working with the older adults, if you saw any?
Well, when we first arrived to St. John's, the first thing we were asked to do was to actually do a behavioral health needs assessment. And in doing so, we really began to identify that many of the elderly were either left behind because their family members were able to leave the island. In some instances, the elderly were housed in a few of the hospitals, or they were in congregate shelters, mixed genders, and obviously age groups. But I think because St. John was extremely remote from what was happening on the other two islands due to limited transportation, one of these shelters really had more of the elderly people, and that's where the mixed group existed. We also learned as it became closer to the time that the schools were going to reopen, the elderly then became very concerned about where they were going to go. And so our team worked well with a medical team of Commissioned Corps officers that was also deployed to the U.S. Virgin Islands, and we tag teamed every day to make sure we could do our welfare checks, find out what the needs were for anyone, whether it was mental health or substance use or medication. And we worked pretty well to make sure that those needs got addressed either in the field, and if the medical clinic was operational, we were able to get them there as well.
Great. You mentioned a lot of things we're going to really address during this webinar. One of the things that you did mention also is working with the older adults and making sure that they were connected. And one of the biggest concerns is, there are a lot of older adults on the islands, and them either being on their own with no caregivers nearby, or possibly they just need some support, which is a big thing that you mentioned. Carlos, did you experience any issues, anything with the older adults? And do you have anything, if you had experience with any concerns about no caregiver available? What did you guys do?
We sure did. Part of the assessing the immediate disaster response is to evaluate situations like these. So the elderly population there is one of the most, if not the most vulnerable populations. So they have to rely on relatives for immediate care, for medicine, transportation, housing, and basic needs. And also, it became apparent that as time went along, these needs were still there, and behavioral health needs began to resurface as a need for this specific population. Things like depression, anxiety, not knowing what's gonna, like Camp Finch said, not knowing where I'm gonna be heading next. Am I gonna lose my house? Do I need to go to a shelter? What's gonna happen with me? So those were identified as the most significant needs. One being housing, FEMA applications and processes, and definitely behavioral health among the top three.
Very good point. And I know because you mentioned behavioral health and everyone trying to, where do we go next, move on. Megan, I know your team has worked boots on the ground for a lot of behavioral health issues. Did your teams report any concerns about the older population? What have they done as far as working with them in the field?
So from the very start of the crisis counseling program, they had also specifically mentioned wanting to target the elderly populations that were both in the communities as well as in elderly homes and hospitals across the island. And they knew that it would be difficult to access a lot of the population immediately after the storms due to a lot of the destruction that had occurred due to the roads and bridges and the difficulty physically getting to some of the communities. And then once that they did have access to those communities, being able to build trust and a positive relationship with the elderly to help them facilitate the crisis counseling services. And so one strategy they used to help build that relationship was through music, and especially during the winter holiday season, and really encouraging them to partake in the activities they would have before the disaster had hit. So they really encouraged them to sing Christmas carols and to make instruments and to engage in their traditional holiday activities. And that helped build the trust to then start having the conversations about their emotions and the reactions that they were experiencing following the disaster, and then could lead them to additional crisis counseling services or referrals to further behavioral health treatment if needed.
That's a great engagement activity. It sounds like they really enjoyed it. One of the things I know that the islands both suffered from is, just between the amount of disaster they all experienced, one of the first places everyone goes to after a disaster is the hospitals, shelters, things like that. How do you feel the hospitals or especially for the older population, nursing homes, how did they prepare for this disaster? Did they prepare for this disaster? What was your experience, Dennis?
So I think my colleagues would agree that we can prepare, and there are wonderful resources out there from HHS and FEMA and other resources on preparing, but you really could not prepare for what actually transpired with Hurricanes Irma and Maria. They truly stand apart from all prior disasters. Again, I go back to the importance of everybody needs information. People need information in order to make informed decisions. The challenge for me was to ensure of how we would create information sharing, particularly for those isolated populations, whether it's older people in a nursing home, or frankly older people living in their own home that may be remote and far from the nearby cities or towns. How do we communicate to them? How do we keep them abreast of what's happening? How do we inform them of where resources and services are available? How do we account for them, which becomes a major issue? So really working around a strategy of gathering accurate information, ensuring that the leaderships of various organizations, including nursing homes, are at the table. And so we ultimately needed to create a mechanism for that.
Great. Thank you for that information. Wanda, did you see anything as far as when you first arrived, as far as working with the hospitals? I know on St. Thomas, actually, the hospital was pretty destroyed. I don't know to what a capacity, but my understanding it was pretty much devastated. Do you think they were prepared? Did they, were they feeling overwhelmed? How did you see their reaction?
I think one of the things people need to keep in mind about the U.S. Virgin Islands and Puerto Rico is the location. And I think that helps put in perspective how the behavioral health needs can be extremely important. And when you have an area that's been impacted that way, it's not just the residents, not just the elderly, it's the caregivers, it's the hospitals and all the other personnel. And so when you balance trying to meet those behavioral health needs, this is why officers such as the commander and I can play a very important role when we're there, is to do some training, which we did do on all of the 3 islands for the Virgin Islands. We did some psychological first aid training for everyone, for the elderly as well as those caregivers. What we did observe is the hospital attempting to make accommodations for the lack of other buildings or the damages that had been done. And in many instances, those elderly who were maybe either in a nursing home or their family members were able to bring them to a shelter or the hospital even. The hospital made efforts to accommodate their stay and pretty much admitted them to the special unit where other elderly patients were already in existence.
let's discuss. I mean, it sounds like things are, like you mentioned, it's very chaotic at this point, and everyone's trying to kind of recover, find their way. Let's talk about after the disaster. Now we're trying to get these people back on their feet. How do we engage these elderly adults, now that we know, finally identify where they are, be able to gather them? Carlos, I don't know if you experienced that. How would you engage these elder population and getting them the support they need, as we've discussed throughout this webinar?
Sure. I mean, it's important to understand to put things in perspective. You know, the event is an event that occurred, excuse me, in one specific time, but the lingering effects are devastating. So the way to engage in our situation with immediate disaster case management and behavioral health is to utilize the resources within the same older population. Remember, these folks are the most vulnerable, yet they are in need of information. They also want to partake in decisions that are being made in their communities, because as elder, they have a lot of knowledge and understanding, but also they're victims. So one of the things that was fruitful for us is to engage them in what they develop as a community, in micro communities of self-sustainability. For instance, some of these members were able to build infrastructure in their own particular homes, build grids in their communities to be independent from the local authority, power authority, and also bringing in the concept of the medical providers and service providers and healthcare providers and mental health care providers into their homes, using the engagement with the seniors. You need to allow for them to participate in the decision-making process that is going to be impacting their communities.
No, that's a very good point. Culturally, they're very proud people. They like to they need the help. They want the help, but at the same time, they will not ask for the help. And that's one of the things that I experienced when I was down there. So I completely understand where you're coming from. So Megan, as far as your team's going out there, they're going door to door, they're going to shelters and checking in on these people. What are they seeing as far as, how to engage? Are they having issues engaging the older adult population? And if they are, what kind of things are they doing to kind of be able to engage them into, some sort of support, whether it be behavioral health support or even physical support, like housing or just medical support because they need their medications?
So the crisis counselors do go door to door throughout all of the 78 municipalities. We also have a number of them that are stationed within FEMA's disaster recovery centers as well. I believe there are about 68 of those across Puerto Rico, still in the majority of the communities. And they also have connections and relationships with many of the elderly homes and hospitals and a lot of the communities as well. And so they are engaging the elderly whenever they do come across them, and are able to provide both individual and group crisis counseling sessions if that is needed. Another great resource that we have available is Linea Paz, which is a 24/7 hotline that's available for anyone in Puerto Rico to call into. And we support crisis counselors who can answer the phones and speak to anyone who calls in as well. And they can provide referrals to further behavioral health treatment if necessary, but also any type of information that may be needed to help support the disaster survivors of any age.
That's great. And hopefully we'll be able to provide that information for our viewers so they can actually be able to call if they know somebody who might need it. Thank you so much. One of the things that has come up in a lot of the conversations, a lot of news outlets, is the suicide rates. There's been concern that the suicide rates have gone up since the disasters. I'm sorry, I hate to say it, but not that it's expected, but it's, we understand why. There's a lot of anxiety, a lot of stress. What are kind of things that families or friends can, recognize that might help them be able to identify that in their friends, family, co-workers, anybody, that they can hopefully help them so we don't have this as an issue. Wanda, I know you were on the boots on the ground with the psychological first aid, so you know. What kind of things can a regular person look for?
I'm going to give 3 areas that I think are probably most important to keep in mind. Listlessness, loneliness. We know many of our elderly are already with families. The communities are remote, so isolation can tend to be an issue. The other is persistent worry. One of the things all of our teams, I believe, experienced was, well, what happens now? If you all are leaving and the docs are leaving, who's going to be here to help me? Who's going to help me make this transition? And the final thing would be the hopelessness. As we talked about earlier, we learned that many elderly just could not leave the island for various reasons. And for those who were left behind, the hopelessness of when might I see my family, when is my nephew coming back, became more of a reality for some because of the length of time that it was taking for the recovery process.
Wow, that is kind of... and I don't know, Carlos, do you know of anything that you could... I know you experienced a lot with the older adults. What would you say is a good way to identify people in your community? What can we do to help them?
Well, they need to engagement, for instance, knocking on their doors. Those disaster recovery centers, which there are 68 of them in Puerto Rico, they don't necessarily have everybody go into the disaster recovery center to ask for help. Well, that is very challenging and very limiting. So the connecting the services to their homes, or where they're dwelling at that time, it's really important. But I wanted to emphasize a little bit on the readiness, which is a constant. Readiness is a constant self-evaluation of the system. No system is totally ready for a disaster per se. So what we need to do is continue engaging communities and those senior citizens and in those communities' decision-making processes, and also what Dennis was saying about disseminating the information and doing it in a continual basis. The hospitals and the nursing homes, for the most part, did conduct a preparedness, but I was told when I visited them that they were not ready for anything longer than 21 days post-disaster. So anything after that would have been long-term recovery. So they were very limited because everything collapsed.
That's a functioning hospital that has no damage,
Yes.
I'm assuming.
Yes.
That has not had any damage, have all the resources in place, ready to go.
Yes.
And we're talking about hospitals, like I know, like I said, St. Thomas, I know for a fact the hospital was destroyed. Mm-hmm. So we can only imagine those days are cut probably much shorter than 21 days at that point, when especially to the mass amount of survivors that are coming in to seek services. So thank you, I appreciate that.
And I'd like to add to that, the communication piece that I think Mr. Romero brought up is important. For St. John, it was so important because they're like the most remote island of the 3. Their community leader dedicated to go to St. Thomas every day to the 8 o'clock meeting at the National Park Service and bring back information to inform that community. Now, that community in St. John, a lot of retirees. So the communication piece was definitely an important one.
What kind of key preparedness activities can we do for these survivors? Is there any planned already on the islands that we know about? Let me ask you, Dennis, maybe you know of what's going on, how, what planning activities have begun, what kind of things that they're looking to do to, say, prepare, hopefully. Like you all said, preparedness is key, but at the same time, nothing, can't prepare for things like that. 2 Category 5 hurricanes right back to back is not something anybody can prepare for, but what can we do and what is being done?
So soon after the hurricanes in Puerto Rico, I'll start, we established a behavioral health coalition or stakeholders group. And initially it was just behavioral health, public providers and private providers and government providers. And very quickly that group that stakeholders group evolved to include other sectors of health and human services. And although the main goal was to share information among the various from various perspectives, but also inform one another of needs, so that the larger group could then begin to discuss this. Now, mind you, this is all focused on behavioral health, but very quickly we realized that we needed to focus on older adults, and we needed to focus on youth more specifically as groups.
Populations. Got it.
So this was a very key effort, and which is running today.
It is currently going. Wonderful. Wonderful. And I don't know if anybody else has heard of any other projects that are going on for preparedness for the future, any sort of activities that they're doing in the field.
Right. So SAMHSA's Bringing Recovery Supports to Scale Technical Assistance Center strategy, we provided some training to assist Puerto Rico. And it's basically using the leaders of the community to provide authentic peer support, just listening and knowing how to respond were the basic focus of that. And just to briefly note, we also trained all of the emergency providers, including those community-based organizations that were also there helping out, many from the U.S. We trained them in psychological first aid so that they would also be able to recognize some of the signs we described earlier for the elderly.
Wonderful. And of course, I think one thing you all mentioned was information dissemination. That's very key. That's been talked about throughout this entire broadcast. And I know SAMHSA has a ton of resources online that we have available to anybody. And I believe FEMA has a ton too. Help me out. ASPR, I believe, has a lot information. We share a lot of this resource information, but these are resources that are available to anybody. So it could be providers, leaders, community leaders, just your family members can look it up. So hopefully our viewers can do some research on their own and look for that information.
And a lot of it is in Spanish as well.
Oh, so they're translated to Spanish on top of that. So hopefully we won't have any issues. But those are all free and available to the viewers, and they can actually research that information, which is wonderful. And we continually try to build on those resources based on what we're experiencing, what we see the need being year after year. So I hope that the viewers get a chance to go look and learn for themselves. And I guess one big question I have, and this is going to be I guess my final question would be just, we talked a lot about behavioral health, and that's the key of what we're doing here is discussing this response and disaster in behavioral health. What kind of gaps are you seeing, hearing? You know, we want to obviously learn from this experience and make sure that we are prepared, or at least trying to prepare for the next kind of disaster. Let me start with you, Dennis. Anything you heard, any gaps that you're recognizing here in the field that we can try to work on? Yeah,
I think the biggest lesson learned was recognizing that for the older adults in particular, when it comes to behavioral health, is that they have a harder time transitioning from what we call disaster response from disaster recovery. And those are very two unique aspects of the response phase. Older adults have a hard time. They still want to stay in the mode of waiting for others to come to them. When sometimes it's important to begin to take some self-care and self-initiative. Right, definitely. And Wanda, anything as far as your experience, especially on St. John, being that it's a very retirement locale for retirees, what would you say, based on that experience, what gaps may have been, or what can we work on?
I think the one thing that stood out to me on that mission was the communication piece, collaborating with the medical team to be able to go and outreach. And that's where we found the elderly because, they weren't coming in, aside for the few who lived not too far from one of the distribution centers. And many of them walked if they were somewhat close. But when you think about the rural location and how St. John was pretty much set up, it becomes a bigger issue. So being able to travel on the island is probably the optimum condition, is what I would suggest.
Okay, great. Communication, travel. What about you, Carlos? Any experiences of
Yes,
gaps?
as far as behavioral health and for the elderly, we need to understand that even though the infrastructure in Puerto Rico was pre the disaster was there for mental health services, community services, it has never been tested to this point. So it changed the way responses and services were being offered, or their ability to build the infrastructure, to sustain the infrastructure. And then our challenge was, when I say I, the partner agencies, FEMA, SAMHSA, AMSCA in Puerto Rico and all that, is to help the local communities and governments to rebuild their own infrastructure so that when the next hurricane comes, the infrastructure is there in ways that were not thought about before. So that's a challenge, that's a behavioral health gap that we need to, actually that they're working on for the future.
So they're working on some sort of disaster plan towards any sort of future
Events.
Great.
Because the infrastructure got wiped out, if you will.
Yes,
Yes.
I understand. Dennis, did you?
Yeah, I was just going to say that the behavioral health coalition that we established has as its future work is to help create that disaster preparedness effort.
Portion of it.
Yeah.
Got it.
If I could add one other thing, and I think Mr. Romero mentioned it earlier, and that was data. Census information to be a part of that, not just the data on, where the elderly are located. One of the things we found as we continued to tag team with the medical team and we were encountering elderly persons who were still at their home, we then later realized that just about all of them were known to be service recipients at the clinic.
Oh, okay.
So we then began to create this census list, if you will, of where they were located, because many of the road signs were down. So
Right.
it would make someone who's not from the area, it would be a difficult challenge to get around.
Definitely. And I remember seeing this roads.
Yes.
They're impassable, flooded, live wires down, very dangerous situation. And when you're in need, that's a very difficult situation. Megan, anything as far as your teams were recognized as gaps in their buildup of this program? Because I know your program has to start kind of building itself and then going out there. What kind of things were their obstacles as far as being able to get those behavioral health services out to the survivors?
So one thing that we've identified is just because of the lack of available clinicians and behavioral health providers that were prior to the disasters, being able to provide additional training and clinical support to those behavioral health providers that are in Puerto Rico. And so we are working with Puerto Rico to provide additional trainings to their clinical staff that's on island, as well as clinical consultation services to help rebuild their infrastructure for behavioral health providers as well.
As Carlos was saying.
Yes.
Wonderful. Well, thank you. This has been a great conversation. I really appreciate all of you for joining me in this discussion. I'm hoping our viewers get something out of it. This has been a very eventful disaster, obviously, and I think we've all learned a lot from it, and hope that the future of the behavioral health program response will be improved from this. So thank you. Appreciate it.